Good morning again, Florida. It's Saturday, the 28th of March. As you can see here in Brno, we're having a very, very sunny morning, and this bulldog is back from mommy's house. So he'll be here for the next like 3 or 4 days, and you can see he's kind of chill. He's not really aware of what's going on outside. Actually, he is a little bit because he's actually quite nervous all the time. And the city's quite busy, and now there's nobody in the city, so he walks around and he's chill and he's not stressed. So like, silver lining. So basically, I've been following the situation, of course, as usual, in Florida and in the United States and in Europe, and like as I told you guys, like the situation there is going to get worse. That you're just kind of like, it's like the tip of the spear. You're right at the beginning of the situation. Like currently now, you guys have what was it? Yeah, like 3,200 confirmed cases. But since they're not doing testing in Florida, like my friends told me yesterday that they're running out of tests, that people are denied tests for various reasons, and the bottom line is just that they don't really have testing in Florida right now so much. So basically the numbers in Florida, they have tripled in the last 3 days. That's fast. The curve is really, really kind of like it's starting to shoot up. So basically, if it triples again in the next 3 days, which it probably will, you're going to be up to about 10,000 cases. Boom, just like that. If you look at the New York numbers and see where they were like a week ago versus today, you can see exactly how fast it's going to rise. There is the possibility that possibly, that maybe the maximum number of cases, like the peak in Florida, might not be as high as New York, just based on the fact that like a lot of the cases in New York are in that one very, very tightly like densely populated area. In Florida, it has some population centers. If you look at the map of Florida, like, for example, it's like Dade and Broward, of course, are kind of like the two biggest ones because, that's where they have like the densest population in Florida. And, for example, North Florida is very, very sparsely populated, so maybe the numbers up there will not be quite so great. But still, I mean, like, it's still going to be ridiculously high. And then the other problem with Florida is, just the average age and the fact that you have like 4.7 million people that are over 60, okay? And I was there, and you also have a lot of heavy people, so you also have a lot of diabetics, and all those people's lives are at risk, basically based on the behavior of everybody else. Like we said, stay home. Just for a comparison, this is the thing. Like I mentioned this before when comparing kind of like the United States to the Czech Republic, because I've said like in Central Europe. We are having much, much, much more success as far as like, at least keeping the death rate down, which is, and that's kind of like, that's the key thing here. It's not necessarily to, it doesn't matter about how many cases you have. It's actually about like how many people die. That was the whole thing about flattening the curve. You have all your cases over a longer period of time, and that way the medical system will always be able to provide the best care for everyone who's infected. Whereas when you do nothing, you have the spike, and then you have the cases at one time, which are here, and the available like ICU beds and ventilators is here, and this is where you get all the deaths. Okay, so this is the reason why you're trying to keep the thing down. It's not about to lower the overall number of people that get the virus. It's just about having them spread out over a longer period of time rather than everybody at once. So for example, like I mentioned this before, that in the Czech Republic, basically, we are 0.9 deaths per 1 million in our population. Okay? So we're at 0.9. All right? Florida right now, you're at 2.1. Okay, so you're a little more than double what we are, and you're at the beginning. We've been doing this for a while. I was checking our numbers this morning, and the number that you guys need to look at, if you can find this, okay, I'm having difficulty finding information for Florida. For some reason here, they are producing. I mean, in multiple websites, multiple agencies are, they're producing lots and lots of statistics. I mean, like we can track this thing. We really know a lot. And in Florida, I mean, like the information actually is quite limited. I mean, they have the map thing where you can see how many cases there are in each county, but they're only updating this twice a day. They're updating this at noon and then 7 o'clock in the evening. So from 7 o'clock in the evening until noon the next day, that's what, like 19 hours? Is that right? 17 hours? Yeah. Yeah, 17 hours where, I mean, there's no new information, and that's not, I mean, that's a bit too slow. They've got people that are IT specialists in the bureaucracy that work for these departments. They need to be able to kind of like produce the information kind of like more often than that. I couldn't find anything about the epidemiological reproduction rate, which is one of the key things. That's the thing that tells you basically like what speed you're on. Are you kind of like, are you at light speed, or are you kind of like just like poking along? Because I'm trying to find the numbers and by doing the calculations that you guys are somewhere between like 2.5 to 3, which is, that's kind of like warp 2. It's actually quite fast. This morning we're back down to 1.5. And again, we're going down over the last 2 weeks. There's been a couple of bumps, and oftentimes those bumps are because, they increase the number of testing. They got more tests, and they go out and test a lot of people. So of course, when you test a lot of people, you're going to find a lot more people that are, positive but asymptomatic. Okay, and again, this is something that that's been coming out of the White House, and I don't think this came necessarily out of the CDC, but this idea that they keep telling you guys, and I've seen this on a couple of different news sources in the United States, that if you're asymptomatic, you're not contagious, which is again, apologies for the language, that is 100% absolute horse shit. Okay. If that were even remotely true, then the only people, the only people that, can give it are the ones that actually have this, that are symptomatic for it. Like, what? No, we know that's categorically not true. That the problem actually is, for example, like those kids, the spring breakers, is that, they probably will go around and have absolutely no symptoms, but, they're going to spread it to everyone and kill grandma. So when you hear these things like these like when you watch these press conferences and you have some leaders that say, we're not going to test everybody because the people that are not symptomatic can't spread the virus, that's categorically false. Okay, we know that. For some reason, our health ministers are telling us that. That's kind of like, it's not even like an open secret, it's just a fact. So when you have people there that are telling you that, this is the reason why they're not testing you, no, it's not true at all. Either this person is stupid, which like Fauci and all those people, these are not stupid people, and I don't think they would not be saying this, but if you have other political leaders that are saying things like that, no, it's an excuse to cover up failure, or that they just don't understand the science, which for some of those people, I've been watching the press conferences, and yeah, it's quite clear they don't understand the science. Okay. All right. Now, the other thing was like, so like in the U.S., you're at 105,000 now. So you've doubled in 3 days. Okay. We are doubling. Wow. I think we're doubling kind of like maybe. I think we're kind of like between that week and 2 week thing. We're still getting new cases every single day, but that percentage is not increasing. We're at I think yesterday we added 200, or maybe yesterday, and we're just over 2,000. So we're kind of like under that, adding like less than 10%. Okay, and in Florida, for example, was in the last 24, well, between Thursday and Friday, until last evening at 7 o'clock, you added 33%. Okay, and it was again, it was 35% the day before that. So you guys are really, really increasing a lot, and you need to expect that. So like I said before, if if you still have not gone out and done your shopping, go ahead and do that. One person. I've heard things like in Florida, like people are going out shopping and they see entire families in the supermarkets. Like they kind of like brought mom and dad and the kids are going to the supermarket and hanging out, smoking cigarettes, talking to people in front of the stores. Everyone like congregating in groups. That's not good. I've said it before. So you need to make sure that your people are not contributing. You need to spread this information on your Facebook. You need to share these videos. I mean, I know these videos are kind of stupid and crap. That's not the point. This is not about production quality. This is just about giving you the information, trying to protect you, trying to like save people around you, your grandparents and the ill people. So you need to be proactive. I mean, it's not enough now to follow the rules. Which are again, stay home. If you leave the house, wear a mask, wear gloves, keep the distance between the people. Only send one person to do the shopping when you come home. Again, you know this. The first thing you do is you slip off your shoes, then you go wash your hands, then you bring in your groceries and you unpack them and you wipe them down. Then you wash your hands again after you have everything put away, and then you go and greet your family and check up on everybody. Okay, so between the time you walk in the house and greet your family, you should have no contact with anybody until everything's put away and you've done and wash your face also. And take the masks off from behind. And one of the things, I have surgical masks, and one of my friends suggested this to me because I was actually reusing them. I got like 6 of them, and I was starting to worry about like, am I using these too much? And one of my friends who's in the medical profession actually said that you can just spray disinfectant on them and like just hang them, and then you can reuse them. Obviously not if you're in a hospital, because like that's something completely, but if you're walking around in public or when going to shops and stuff, yeah, that's fine. Yeah, so like because I mentioned this before, I saw like Walmart's doing sneeze guards. That's great, but you still need to have masks, okay? Because if someone kind of like is breathing into the sneeze guard, the stuff's going to kind of like make these little whirly things, and some of it is going to go on the other side of that sneeze guard. As I saw it, it's not like kind of like a bank teller window where you've got just that slot kind of a thing. No, I mean, it's literally just a piece of plexiglass that they put between the cashier and the shoppers. And, the idea that that's not creating 2 atmospheres, the molecules can easily go around that. I mean, that it'll make someone feel better, but it's really not protecting anything. I mean, like a very, very little amount. You need to have stuff on. You need to have stuff that's actually protecting your face. All right. One of the other things, and this is so irritating about you guys having to politicizing everything, is on the Florida statistics. There's a lot of stuff missing, but the one thing they did add there from the state of Florida is which of the people who are infected are residents of Florida and which ones are not. Okay? This might be interesting for some of the weirdo conspiracy theory, like, some of the most stupid people in Florida, extremists, basically, who's a resident and who's not, always trying to divide lines, always trying to, like, put people into camps and stuff like that. That is the least of your worries. I haven't seen any other state that's done something as stupid as that. So Florida is actually taking the time to, categorize, like, who's got the virus, who's actually a Florida resident, and who's got the virus, who isn't. It doesn't matter. The virus is already there. That 3,000 cases that you have this morning, that's like just the tip of the iceberg. Because they're not testing anybody. And we know from the epidemiological curve, that a lot of these people that could get symptomatic in the future or will test positive in the future, they already have it now. They could have had it up until 13 days until now. Okay, and then today's the 14th day, and some of them will get symptomatic because we know the incubation period generally is kind of like that. I've seen 2 to 5 to 14 or 5 to 14. I'm just saying 5 to 14 because, just to keep everything the same. So, this idea that, like this resident versus non-resident who's positive is again, sorry for the language, it's horse shit. Those types of things don't matter. It's just kind of like, they've got like, we dropped the ball, we were unprepared, we are incapable of handling the situation, so now we need to kind of like scapegoat people. I mean, what are they going to do? Are people in Florida going to start like putting stones through car windows of people that have got like New York or New Jersey plates or something? Is that where you guys are going with this? No, it doesn't matter where the hell the person's from. The thing that's important is the fact that you've got this virus in your state, and you've had it in your state for a while now, and nobody has been doing anything, and the people there are still behaving like fools. That is the most important thing. That is the most important thing right now, is to contain it, to save lives. This is not a time to point fingers and blame people. This is a time to come together as one state. You need to you all need to work together. And the way you're going to do that is by, policing your neighbors, policing your friends, spreading the information on Facebook. That's the thing. You have to try to teach these people how to behave. You need to keep trying to find new ways to explain to them what they have to do, because, clearly they're not getting it. And you need to be inventive, okay? One inventive thing that the Czech Republic has done, and this has been amazing, was that this group of people from this technical university in Prague, they actually developed a way to make ventilators from pre-existing mechanical products, or from parts, and so it was something basically kind of like crowdfunding. And they raised, I think it was like 12 million crowns in 24 hours, which is about $400,000. And because, a lot of the parts of this were already pre-existing, they didn't have to actually manufacture. It was basically kind of like, taking these pieces and putting it together, and here's a new ventilator. They got the price down really, really low. And I think they had something like, I think they're going to get like 1,000. They're going to get 1,000 ventilators, and 500 of them will be delivered within the next 3 weeks. Okay? This was not even kind of like, the government telling them to do this. This was just people taking it, doing this on their own. Okay? And we do have, so far, more than enough hospital beds. We actually have already, I posted this on Facebook yesterday, actually, and it's worth mentioning. All right, so, when I was in Florida this summer for the first time in a long time, and, one of the things that really surprised me the most was were the shopping malls. They were just these post-apocalyptic ghost town things. Like for example, University Mall in Tampa, I was just like, what? That they just had these massive areas. For example, the Sears store was huge. This 2-story thing, big open area space. And yesterday I was just talking to people, and I said, that would be a really, really good place to, make a hospital for the pandemic. In Brno, basically, what we did was we have a big the fairgrounds, convention places and stuff like that, and so they've converted one of these massive pavilions, like this big, huge open air pavilion. It's got a glass ceiling, so it's lots of light and goes in there, and so they've converted that into kind of like a temporary medical facility. And but I don't even think they're using it yet, because even our hospitals, they've been having enough beds to do this. They did that, and IKEA. How we say it in Europe, actually. Yes, for Americans, it's actually not called IKEA, it's actually IKEA, but whatever. So IKEA basically either donated or they gave a big discount to the city of Brno, basically to supply them with beds. Okay, and I had the same idea. I was like, in Florida, you've got all those. It would be simple, because the numbers are going to go up, and your hospitals are going to be overwhelmed. So instead of having to call around to figure out which hotel you can convert and things like that, no, seriously, for example, like I said, University Mall in Tampa, for example, is right next to University Hospital. It's literally kind of across the street. These are big open air areas that already have electricity. They already have plumbing. It wouldn't take a whole lot to actually, convert them into medical facilities. And then again, if I mean, talk to IKEA there or whoever, even like maybe the army, just get cots, whatever. It would be a very very fast way to create a huge amount of hospital beds in Florida by just using these massive unused retail spaces. It's already there. So anyway, so they crowdfunded here. Okay, because I've seen the thing with like the White House and the Defense Procurement or Defense Production Act. They don't know how to use this. They don't understand how public contracts work. It's really quite clear. Because there was even the thing with GM that the White House said that they've done something, and GM said we haven't heard anything, and this is not the first time this has happened. And the fact that okay, I'm going to get like a tad political for 1 second because this is just something that should not be politicized, and for some reason it is. If you've got a state that needs something from the federal government, if the federal government can do that, then they should do that. Okay? In the last 24 hours, it has become apparent to me that the White House, I wrote this on the paper actually, I'll just say it. The White House seems to be operating under the system of whoever kisses the White House's ass best will get the most assistance or get the assistance faster. That's absolutely absurd. It's a democracy, and part of being, part of the right of free speech is the right to criticize people. Sorry, if the federal government is not doing something that they should be doing, and these governors know this, they should be able to criticize that. This sycophancy where it's just basically the only people that get it, the people that get attention is like the people that are kind of like, oh God, yes, Mr. God, thank you very much for for the handout. It's like the White House is basically treating the states like a bunch of dogs that have to fight over the scraps that just get knocked off the White House's table onto the floor. It's absolutely ridiculous. The way that the way the thing works is you create a contract. You say we need this, and you say who can do this, and then someone raised your hand like we can probably do this, and then the government you do a contract just like that. And you tell them okay, we need 100,000 at this price, go, and then the company does that. That company needs that guarantee from that contract at the beginning before they can start doing that. It needs to be legal. It needs to be signed, and they're kind of missing this step. I don't understand how the White House thinks that they can just kind of like say something and then people are going to go, oh yes, it doesn't, it's not a dictatorship. You still have to kind of like, you have to go through the process. It's very, very quick in this situation. But, the private sector needs the direction. They need the guarantee that they're going to get the money for this because they have to invest a lot. You can't just convert a factory overnight into doing something. It takes some money. It takes some resources to do that. And right now, with the economy where it is, they need guarantees that that investment will come back. And that's why this is one of the reasons why this particular piece of legislation was created in the first place. They're really massively dropping the ball about that. It should be easier. It should be available for the people that need it. And there should be no kind of like ranking based on, the ability to kiss the president's ass equating to, how much help you get. And again, this is not even a party thing because, some of the Republican governors are doing a really, really good job and have also been kind of like not thrilled about the federal government response. This is not Democrat Republican. This is just kind of like this weird narcissistic ass-kissing thing versus the pandemic. And the people that can't see that, I've just seen something. oh, God bless, blah, 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 and helping. And I'm like, helping who? I'm not really seeing it. Um, so, all right. Now, last thing, Germany. Ugh. Just to give you guys some information about Germany, all right? Because Germany has a lot of cases, but Germany, I think they only have a couple hundred deaths actually, maybe 300 max. I mean, they had a really really low level of that, and if you want to know why, it's because Germany again, like the rest of the European, actually like the rest of the West except for the United States, we have this like socialized medicine system, and Germany started testing early. They've tested a lot of people, and now the news this morning, they're planning on they want to increase to having 200,000 tests a day they want to test 200,000 people. They also, I was surprised, and I checked this actually. They have so many hospital beds in Germany, that even at this moment, they have 100,000 free beds. I could not believe that. It's just our system here basically, because healthcare here is a human right. Okay. And for example, or if you have an illness which is life threatening or going to really cause a significant decrease in the value of your life, that's always going to be free. That's just it's a different mentality. It's a different philosophy. But again, this is kind of like the United States is kind of the outlier. The rest of the Western world pretty much has this. Canada has this. Australia is also a little bit kind of like, but it's a human right, and so they've got all these extra beds. One of the problems, specifically again, with one of the problems with Spain and Italy. It was really kind of like almost kind of like a cultural difference, because the people there, like the Southern Europeans basically, are much more touchy-feely, friendly, those kinds of things. And even in Italy, when they quarantined the areas, okay, people were still traveling around and they were still visiting each other. You can see pictures online of people like having dinner parties with their neighbors and stuff like that. And they weren't. The thing that it happened in Italy, and this idea of like social distancing was kind of like still in its infancy. Okay. And they also had people from the quarantine area that had traveled outside of that. So if you can imagine kind of like, the spring break thing, like how tens of thousands of people, I mean, like maybe hundreds of thousands of people there. I have no idea, but a lot of people. And then they go out, so and then again, it takes the virus time to incubate. So, I mean, like there's going to be massive clusters in the United States specifically because of the spring breakers. I'm just telling you that right now. They're going to, when they actually have all the epidemiological things and trace the people, yeah, there's going to be a massive like link that comes back to South Florida. Well, so anyway, so like we have this thing where we generally kind of like try to take care of the people, and like in Spain and Italy, even from their behavior from 4 weeks ago. This is one of the reasons why now the system is becoming overwhelmed, and this is exactly what we're trying to prevent happening in the United States. And this is why a week ago or 6 days ago when I started making these videos, that was the whole point, was try to prevent an Italian situation in Florida, or to prevent the Spanish situation in Florida, because like the first time I did these videos, I basically said there are 4.7 million people over the age of 60 in Florida, not counting the diabetics under the age of 60, because there's a lot of them, or people that are, have just had cancer treatment, those types of things. There's a lot of people there, and the setup of the healthcare system in Florida, if you compare it to European countries, it's really sparse. It's very, very Spartan. Okay, everything looks pretty. You've got beautiful machines and all these things, but you're not actually, the healthcare system in Florida really is not capable of taking care of a whole lot of people. This morning, and I checked this twice. I found it from several like actual like reputable news sources. Reputable news sources. about the 17-year-old boy in California that died because he didn't have health insurance, so he was denied. He presented with respiratory issues and was denied treatment and died. You know, that's something that you guys need to think about. Because that speaks to the soul of the United States of America, that's actually permissible. That would never happen here. That would never happen in Canada. That's just something that, the rest of the West, we've solved that. We take care of our people. We make sure they have food. We make sure they have health care, because those are kind of like their human rights. And honestly, when you do that, it also kind of like, it keeps your crime rate low. It keeps your crime rate low, because everyone's got the minimum, so you don't have kind of like this like huge giant populations, these poor people that can't even like pay for doctors or things like that, who are like, fighting literally, to, feed their kids, like it's perverse. And just one last thing, and this is really long, and I apologize for that, but it's the weekend. Hey, you can have coffee. The media is, the media, from what I can tell, is they're trying to present information to save lives. And like I said before, listen to the scientists, listen to the people from like the CDC, listen to the people from your like state health departments or state health ministries. Those are the experts. Those are the people that have the titles after their names and the type of training and the type of information that you need. Okay? The words coming out of their mouths counts a lot more than the words coming out of the mouth of some politician with a bachelor's degree in whatever. Okay, a lot of the politicians, like the leaders, are really kind of incapable. Most people are actually incapable of actually understanding the numbers here and the science here. You need to find the people who actually are experts in this area. And a lot of people that are experts in this area don't necessarily do well on television. It's one of those things, maybe they might not be the most charismatic people, but, you don't need charisma right now. You need information, and you need the truth, and you need to do what they say. Like I said, please use your social media platforms. Try to communicate this to your neighbors. Try to communicate this to as many people as you can, that, we're trying to save lives. We're trying to keep the death rate low. And the best thing you can do right now in Florida is just to stay home and get everyone else to stay home, and to keep writing and calling your local politicians to make sure that they enact laws to keep people in place. And, you're going to be there for a while. I've been telling you this all week. You need to expect to be kind of like on this like what was it called, this staycation, kind of like the quarantine staycation, the Ninja Nation staycation. You're going to be there for a month. And the quicker you guys accept that, as a state, and actually work together to do this, the shorter the time period will be. And the flatter the curve will be, and the death rate will be much lower. I hope it's not like, I hope this is not going to be like a too little too late situation for you. Like, I actually have hope that if you guys do this as soon as possible, that you actually can kind of like, it's not going to be quite so devastating, because right now, the numbers are just, it's really bad. And it's going to be much worse tomorrow. It's going to be much worse in 2 days. And, you're not going to be doing anything on Easter, so if you work for a church and the pastor and stuff, you guys need to start looking now at producing some really, really fantastic videos for your Easter services, because everyone needs to be everyone needs to be, celebrating Easter Mass or going to, Easter services, from the comfort of their own homes, so you guys need to work. You need to not be complacent. You need to work. You need to get your friends and family working also. And yeah, sorry for being a little bit down this morning, but it's kind of shocking. Like when I posted a map on Florida yesterday and actually circled the places where my friends and family live, and the counties and the different colors and stuff. And You know, every single place where I've got people in Florida is basically, if it's not a hot zone already, it's going to be one. And yeah, the entire country is going to be a hot zone. So if you're living in a county right now that has like one or two people or nobody, that doesn't mean anything. There probably are there are people there already that have it. They just haven't they're not symptomatic, and because there are no tests, you can't tell. So diligence, diligence, diligence. I love you guys so much, and please, 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 please work. You need to work this weekend to spread the information. Stay home, stay home, stay home. Masks, gloves. Okay. Crazy bulldog. All right. Love you guys, and see you tomorrow.